Hello and welcome to today's lecture on vascular ring anatomy. This is the first in a series of videos that will cover embryology, anatomy, and management of vascular rings. Our goal is not only for learners to understand the basics of diagnosing and managing vascular rings, but for you to internalize the spatial relationships of the structures involved in these vascular rings. First, I will take a moment to orient you to our virtual reality anatomy system. In general, we use both idealized models and imaging data sets from real patients side by side to illustrate concepts in specific anatomies. Under each model, you'll see a compass we've inserted to help you orient yourself to the patient with superior left and anterior directions labeled. Returning to today's lecture, our learning objectives will be the following. First, we would like you to be able to understand the embryologic development of vascular rings. Secondly, we'd like you to understand the typical clinical presentation and workup for symptomatic vascular rings. Thirdly, we'd like you to be able to identify the most common vascular ring anatomies. Fourthly, we would like you to understand the spatial positioning of structures involved within the most common vascular ring variants in the formation of complete and incomplete rings. And finally, we would like you to be able to understand the treatment strategy for the reviewed vascular rings. So let's move on by defining our terms. What is a vascular ring? By definition, it involves blood vessels which encircle and compress the tracheobronchial tree and/or esophagus. Although vascular rings make up less than 1% of all congenital cardiovascular anomalies, this incidence may be underestimated given that some patients can be asymptomatic. If you will step back with me to your developmental anatomy courses in medical school, you may remember that aortic sidedness and branch arteries are derived from embryonic aortic arches, which have historically been referred to as branchial arches. This embryonic development is often modeled with the hypothetical embryonic double arch with bilateral PDAs proposed by Edwards. Here is a two-dimensional picture of this model showing the relationship of the great arteries and the bilateral PDAs. As you can see here, we have converted this into a 3D model, which we'll use to describe various vascular rings. I'm going to focus on the aortic arches that contribute to the postnatal aorta and its branch vessels. As you may remember, the first and second arches largely regress, with remnants contributing to head and neck arteries, so we will not be discussing these further. In contrast, the third aortic arches form the common carotid arteries bilaterally. We've marked these in orange. The fourth aortic arch contributes to a small segment of the aorta just distal to the left common carotid artery and before the left subclavian artery takeoff, as well as a small portion of the initial right subclavian artery. And finally, the left sixth aortic arch forms the ligamentum arteriosum. As you will see in upcoming examples, vascular rings can develop secondary to persistence of structures which normally regress. For example, the persistence of a right aortic arch and a double arch. So now I'll go ahead and describe our diagram a bit further. As you can see, the ascending aorta, the left arch, and the descending aorta are all colored here in red. I already mentioned that the common carotid arteries are marked here in orange. The subclavian arteries we have marked in pink. The pulmonary arteries we have marked in blue. The esophagus we've marked in purple. And the trachea and the bronchi we have marked in yellow. Going forward, structures marked in white typically represent an abnormal structure, and those marked in turquoise will typically mark structures that regress. As you can see, the right PDA is colored in turquoise, while the left PDA is red. In normal left arch development, the right PDA regresses, along with the distal portion of the right fourth arch between the right subclavian and the descending aorta. This leaves the right subclavian and the right common carotid to arise from the right brachiocephalic artery. Next, we will discuss the patient imaging dataset. This patient had a CT scan performed due to aortic coarctation, but fortunately, the remainder of the aortic anatomy is normal. As you can see here, we've maintained the same color scheme, with the ascending aorta, the aortic arch, and the descending aorta here in red. The common carotids are marked in orange. The subclavian arteries are marked in pink, along with the brachiocephalic artery. The pulmonary arteries are marked in blue. The esophagus, as we rotate to a posterior view, is marked in purple, and the trachea is marked in yellow. In future videos, we will continue using the same color scheme you see here. Another important point before we move back to an anterior view is that we had to draw in the extension of the esophagus. This is because even in normal circumstances, the esophagus can be collapsed down when there's nothing descending it. We'll make sure to point out when it's being compressed by a ring. Next, we'll review a couple important anatomic learning points. First, you may remember that the sidedness of the aorta is defined by which bronchus the aorta passes over. In this case, it passes over the left bronchus, designating this as a normal left-sided aortic arch. Secondly, you can see here that the right pulmonary artery passes under the aortic arch, whereas the left pulmonary artery passes anterior to the descending aorta. With that, we will pause our discussion here. In our next video, we will be discussing the clinical presentation and workup for symptomatic vascular rings in the context of our first example of a vascular ring, the double arch. Thanks for watching.